I want to start out today's webinar by giving a big thank you for taking the time out of your day to join us here today for our 9th webinar, part of the Understanding Your Wellbeing webinar series that we launched in 2025 for our Univera members. My name is Katie Keller-Burgess, and I am part of the wellbeing team here at Univera Healthcare. So I will serve as the host for today's webinar, teeing up our guest speaker, Dr. Stacey Elliott, who will be presenting the majority of today's content relative to this topic. So just a few housekeeping items that I always start off with. Please note that today's webinar and all of our 2025 wellbeing webinars are being recorded and housed on our Univera Healthcare YouTube page. So if you need to go back and listen to this recording or maybe access a previous one that you weren't able to attend live, once again, you have on-demand access to those monthly webinars directly on our Univera YouTube page. So my colleague Kate is actually going to put into the chat that link to the YouTube page shortly if interested in checking out any of the webinars. Another housekeeping item we do pull out is that all participant microphones and cameras are automatically disabled. Time at the end of questions with Elliot. Any questions throughout any point during today's webinar, please feel free to enter them into the Q&A icon that once again you can enter any questions you may have, and we will hopefully get to them at the end. And lastly, it is important to know cover here today is meant to serve as an educational purpose. So if you have any specific health-related questions or concerns, do of course recommend that you connect with your primary care provider, or if you have any benefit-specific related questions or concerns, recommend that you call the customer care number that is located on the back of your health insurance card. So with that being said, let's learn a little bit about today's guest speaker. I have the distinct pleasure of introducing our speaker, Dr. Stacey Elliott. Now, Dr. Elliott is a board-certified as well as an addiction medicine physician. She currently serves as one of the medical directors here at the health plan on the behavioral health side for the health plan and has been here since 2022. She is a native of the Finger Lakes region, earning her bachelor's degree from Cornell University and medical degree from the New York College of Osteopathic Medicine before completing an adult psychiatry residency at SUNY Upstate in Syracuse. So her knowledge, insights, and passion around this topic is really so meaningful and impactful. We are so happy to have you here today, Dr. Elliott. So with that, I will turn the stage over to you.
Wonderful. Thank you so much, Katie. So thank you all for taking time out of your day today, probably during your lunch, to meet with us and learn a little bit more about substance use disorders, the intersection of mental health and addiction, how you might be able to recognize the signs of a substance use disorder. I'll share with you some treatment options and resources that may be of use to you or loved ones, how to support someone you care about who may be struggling, and then we'll review some additional benefits and resources that are offered by Univera Healthcare. Like Katie said, I really do welcome questions from the audience. If there's things that come up, I'll do my best to take some time to answer them at the end, because a really important part of taking care of your mental health care is understanding how it applies to your life. First, I want to start off by really giving you the definition of what is a substance use disorder. According to the CDC, a substance use disorder is a treatable and chronic illness, which is characterized by a cluster of cognitive, behavioral, and physiologic symptoms indicating that the individual continues using the substance despite significant substance-related problems. So that's a lot of fancy technical terminology to really say that a substance use disorder is an illness. It is a disease that can last for people much or all of their life, but it is something that can be treated. What makes something a substance use disorder is the fact that you experience physical, emotional, and psychological challenges related to the fact that you continue using a mind-altering substance, even though it's causing you a lot of problems in your relationships and your overall functioning. Substance use disorders range in severity from mild, moderate to severe, and it's possible that people can suffer from multiple substance use disorders with different levels of severity all at the same time. Someone may have a primary alcohol use disorder that causes tremendous havoc in their lives, and occasionally they're also using another substance like cannabis or cocaine, but that doesn't have as much of an impact. Um, According to SAMHSA, which is another federal organization that studies the effects and treatment of substance use disorders, while adults 18 to 25 have the highest risk of drug use overall, we see that drug use among older adults or middle-aged adults, 26 to 49, is actually on the rise. I imagine none of you'd be surprised to know that the most common substance use disorder in the United States is alcohol use disorder. Here on the screen, you can see about 8 categories of substances that may be things that are challenges for individuals: alcohol, cannabis, hallucinogens, inhalants, opioids, which are both prescription and legal opiates, things like heroin, fentanyl, or prescription opioid pills like Vicodin or hydrocodone are some examples. The class of drugs known as sedatives, hypnotics, or anxiolytics. Most commonly, you may be aware of things like benzodiazepines. Xanax, Ativan are two examples, Valium. Other things in this category can include certain sleep aids and other drugs that are really only used for anesthesia but can be abused as well. We have the class of stimulants and psychostimulants, both prescriptions like Adderall and Ritalin, or things like cocaine or methamphetamine. And then a huge category that many people don't recognize often as an addictive substance that can lead to a substance use disorder, but tobacco or nicotine. So while substance use disorders can create impairment or distress that causes an individual to struggle at work, at school, or at home, it doesn't look the same for everyone. For a lot of people, substance use disorders are really hidden struggles. One of the things that I think is really important to convey, and I hope that you leave this talk really taking to heart, is the fact that addiction is a disease and not a character flaw. This is a really challenging concept for many people for a lot of reasons. One of the reasons is the fact that our culture and our society for a pretty long time has really leaned into that narrative that addiction is a character flaw, it's a choice. You continue to use a substance, and why are you just not stopping? If you were stronger, if you had more willpower, you'd be able to recover. And that's just not the case. I'm going to go into details in a little bit, but substances of abuse actually affect the brain and make it harder to stop using them. The other reason that it can be easy to fall into this belief that addiction is a character flaw is because addiction is a painful experience for those living in it and for those witnessing it. It is impossible at many times to feel like you can tolerate the pain of witnessing or being affected by the struggles of your loved ones who are using substances and have really lost control of their lives. It can feel easier sometimes. We don't even consciously realize it, but it's easier to put some of that stress and pain into our narrative around the fact that the person we love is doing this. And if we could only just will it, we could get them better. They could get themselves better. But when we recognize that addiction is a physical illness and a psychological illness, the mind and body aren't separate, and neither is the soul, that we can really work to help our loved ones or ourselves on that path toward recovery, which really depends upon using tools from multiple tool belts, which can include prescription medication, medical management, therapy, and self-help groups, among other things. So why do people develop substance use disorders? There's no one straightforward, easy answer. If there was, I probably wouldn't have a job. Substance use disorders are as unique as the individuals who are experiencing them. Some people may use drugs as a way to cope with stress, trauma, or other mental health issues. That makes a lot of sense. If you are suffering emotionally in some way and don't have a more effective way to manage these unmanageable feelings, using drugs or alcohol can feel like a good solution. Oftentimes that's insidious. You may start not trying necessarily to run or hide from these emotional struggles, but you realize that if you have a couple shots, you feel a little bit better. And that may be true on the surface, but as I'll explain over time, it becomes its own problem. Another pathway to developing a substance use disorder could be that you develop something like an opioid use disorder after misusing opioids as they're prescribed. This can happen commonly with opioids, also with benzodiazepines. So, through no one's fault, no one is trying to get you addicted to a drug. It may just be a whole host of circumstances that lead to this overuse and eventual physiologic, physical, and psychological dependence on the substance. As I mentioned before, substance use disorders can range in severity from mild to severe, and they can affect people of any race, sex, income level, or social class. There is not one single driving factor that leads to addiction, and that is what makes it really challenging. And that is also one of the reasons why it can be very helpful to seek support from a community of other people who understand what it's like to live with or live alongside someone with substance use disorder. Because recovery is a long and painful journey. It's not straightforward and it's not quick. And in order to really stay on the path toward recovery, we encourage in the addiction medicine community, we encourage people to lean on one another because sharing a lived experience is something that really goes a long way to helping us make it through the ups and downs of our treatment trajectory. So, how do drugs alter these important areas of the brain that are necessary for life sustaining functions? There's nothing wrong inherently with any of these substances. The problem is what they do to our brains and our bodies, not just in the short term, but in the long term. So, a little science lesson, if you will. There are a couple areas of the brain that are particularly affected by any of these, what I like to refer to as mind altering substances. We have the basal ganglia, which is this light blue area in the brain. Promise you're not going to be tested later. The basal ganglia plays an important role in motivation and pleasure. So, what makes me want to do things and what makes me feel good about my lived experience. With repeated exposure, this circuit that part of the brain runs will adapt to exposure to the drug. So, it comes to depend on the drug to be activated. And what happens in that case is that it makes it hard to feel pleasure or to have motivation from anything else other than that drug turning on the circuit. We have another area of the brain called the extended amygdala. The amygdala plays a role in feelings like anxiety, irritability, and unease. These are pretty uncomfortable experiences. They're fairly universal, but no one likes them. And some people struggle with these feelings more often and at a more intense experience than others. A challenge with a lot of mind altering substances is that the circuit of the extended amygdala becomes more sensitive with increased drug use. So while you're under the influence of a drug, you may feel less anxious, less irritable, and more at ease. A good example is with alcohol or benzodiazepines. The challenge is that once these substances have left the brain, you are left with the not just baseline anxiety and irritability you may have been feeling. Your floor has actually dropped. Now you feel worse when you're not under the influence. And what's this going to do? For many people, it's going to motivate you to seek that drug again to at least start to feel a little bit better. Over time, it's kind of like falling off of a cliff. Your threshold starts to drop, and your ability to feel an absence of anxiety and irritability goes down, and more substance is needed to kind of get to any place of feeling good. You can imagine this is the start of a vicious cycle. Then we have our prefrontal cortex. This is the part of the brain, literally here in the front of the brain, that is responsible for thinking, planning, problem solving, and most importantly, very importantly, sometimes I think most importantly, exerting self control. This is the part of the brain that does all of that mature work of adulting. It's the part of the brain that takes the longest to develop. It's why we see teenagers, not in the context of substance use, just in the context of growing up, make sometimes really poor decisions, even when they seem like they've got it all together, because their prefrontal cortex is still developing. When we expose our brains to mind altering substances, we shift the balance between the circuit of our prefrontal cortex with the basal ganglia and with the extended amygdala, and we make it harder to exert thoughtful problem solving, long term planning, thinking, and self control. It makes people who struggle with substance use actually seek the drug more compulsively as a reaction to long term exposure to the substance. I covered 8 categories, broad categories of drugs that people become addicted to earlier in this talk. They all act slightly differently in the brain, but as a general rule, you can see how exposure to these mind-altering substances, especially repeatedly over long periods of time, can really alter the way our brain works and can also alter our own capacity to think critically about what we might need to do to stop this cycle of addiction. That's one of the inherent challenges in substance use disorders, is that really by virtue of the illness itself, we have impaired ability to make what a sober person, a right-minded person might say is the right decision to stop using substances. So we're fighting a few different battles all at the same time. Another important thing just to consider and to understand is that some of these drugs, particularly opioids, alcohol, and benzodiazepines, can also disrupt other parts of the brain. Things like the brain stem, which is really that very old primal part of our brain that tells us to do things like breathe without our conscious control. So the brainstem controls things like breathing, heart rate, and sleep. And those functions can be interfered with by benzodiazepines, opioids, and alcohol. This is how individuals overdose on substances like that, because they actually stop the brain from enacting the breathing mechanism, and that leads to overdose death. So as I mentioned before, long-term drug use impairs brain functioning. The the normal and expected response to a mind-altering substance is almost without exception, if an individual continues to be exposed to it over time. For benzodiazepines, it can be as short as 14 days of routine exposure. The individual will find that they need to take larger amounts of that same drug to produce the same response. That's because our brains are really clever and really good at adapting. So they get exposed to a substance, and then our neurotransmitters and our receptors in our brain will quite quickly, in many cases, up or down regulate so that they kind of reset the thermostat. What does this mean? This means that you do need that larger amount of the drug to produce the same response. If one shot calmed me down at the beginning, after 3 months of drinking heavily every day, 4 shots is what I'm going to need to even feel a little bit relaxed. This effect is known as tolerance. It is one of about 12 different symptoms that make up the symptom cluster that means you have a substance use disorder. Tolerance is why a person who misuses drugs eventually ends up feeling flat, amotivated, lifeless, and maybe even depressed. And they're unable to enjoy things that were previously pleasurable. Now people need to keep taking a drug to experience even a normal level of reward. Of course, this only makes the problem worse, and it's that vicious cycle. So, in mental health and in addiction medicine, we talk a lot about co occurring disorders. So, how do mental health symptoms and mental health diagnoses like depression and anxiety, PTSD, bipolar disorder, schizophrenia, how do they intersect with substance use disorders, alcohol use disorder, opioid use disorder, stimulant use disorder? Co occurring mental health and substance use disorders are fairly common. People with mental health conditions are more likely to use substances or have an actual diagnosed or identified substance use disorder than individuals without any mental health condition. In 2023, approximately 20.5 million adults in the United States had both a mental health condition and a substance use disorder. In 2022, 1 in 5 people, so 20% of people who died of a drug overdose, also had an identified non substance related mental health condition. Mental health problems, as I mentioned before, can sometimes lead to drug or alcohol use, as some people with mental health problems may misuse substances as a form of self medication. This can happen for folks who are in treatment and are not in treatment. Substance use can contribute to brain changes that can also increase the risk of mental disorders. A prime example is in the developing brains of late adolescents and early adults. Things are still really vulnerable. And if you have maybe a family history of a psychotic disorder like schizophrenia, your genes may already be kind of primed to develop schizophrenia, and it's not a guarantee. A few things all kind of have to happen in concert for maybe the development of the disease. But one thing that could worsen the potential is to use mind altering substances. Certain environmental factors like stress, trauma, and genetics, like I just mentioned, can contribute to developing both substance use disorders and other mental health issues. That's why we often see these things traveling through families. And the question is often which came first, the environment, the lived experience, the learning, or the genes that were there that were passed along. And it's probably impossible to separate the two. So, what are some signs that someone you know, or maybe looking within yourself, that someone might be struggling? When we notice sudden changes in behavior, this is in relation to substance uses in particular. Sudden changes in behavior, newly engaging in risky behaviors, a noticeable shift in anger and irritability that wasn't there before, really abrupt uncovering of issues at school or at work, feeling excessively tired or having low energy all of the time, not taking care of themselves in a way that they typically used to. More overt, more obvious would be feeling like a person needs a drug to function. And then avoiding friends and family and social activities. Sometimes this can be in response to the fact that they're intoxicated and they don't want anyone to know. Other times, this can be a reaction to withdrawal symptoms and feeling so unwell, they're not ready to interact with the rest of the world. So, we talked a little bit about why substance use disorders are so damaging, how we might be able to acknowledge and recognize that someone we care about is struggling with a substance use disorder. What can we do about it? There are safe and effective ways to recover from substance use disorders. The challenge, but the key, is finding the right treatment option for you. This is the most important component of a successful recovery journey. And what I would add to that is a real awareness and acknowledgement of the fact that the recovery journey is most definitely not going to be linear. That can be really challenging when you're the one living it and you're the one observing it and witnessing it. Someone will get into early recovery and things will look so good and it feels like such a relief. We've got the worst behind us. And 3 months, 6 months, 5 years, 10 years later, sometimes things can sneak up and there may be a relapse. And it doesn't mean that you're at the end of your journey. It just means that there was a really sharp, hard turn in a different direction, and maybe something new is needed in order to get back on the path. The work of recovery is really lifelong work. And that in and of itself is a huge emotional hurdle. A big part of recovery is working through the disappointment and the challenges of acknowledging that this is a job that will be with you for the rest of your life. I think we often think of our mental health as something that we engage maybe in treating and then we've fixed it and it should be better forever. And there are certainly many physical illnesses that are like that. If I come down with the flu, I'm going to feel very unwell and I will engage in supportive treatments to feel better. And I may need to miss a few days of work because I'm vomiting or I have a fever and I can't think straight and I need to sleep. But once I've recovered from the flu, for the most part, it's probably over. It's done, it's in the past. But substance use disorders, like many other mental health conditions, are something that will likely be a part of us for most of the rest of our life. A chronic condition, maybe something like high blood pressure or diabetes. You may be able to put it on the back burner. It may be something that you don't have to think about every day, but you will need to engage in some sort of behavior. Maybe that's taking a medication. Maybe that's going to once a week AA group or smart recovery group, or maybe that's engaging in individual therapy. It doesn't always have to be the forefront, but it will be a part of your periphery for the rest of your life. So, some resources that you can use to find an in network provider if you're seeking treatment for substance use disorders through therapy, psychiatry, or inpatient substance use rehab, you can go to the Univera Healthcare website to find a doctor, provider, or facility that's in network. We do have a partner, which is MD Live, where you have 24/7 access to non-urgent behavioral health care by phone or video. This is obviously a telehealth visit, but for some people, it's that first step that is the hardest. Actually, for probably most people, if I'm being honest. And the challenge with motivation related to recovery is that it comes at really inopportune times. It comes at 4 o'clock in the morning when you're trying to stave off a hangover and you're saying, I don't want to do this anymore. But then it's gone at 6 o'clock the next evening when you may have the opportunity to talk to somebody about it. So we really want to help people find the opportunity to engage in treatment at the time that they're ready because it may be a fleeting experience. On this next page, we have a list of some resources that you can use for treatment, accessing treatment for mental health symptoms as well. The National Alliance on Mental Health, which is NAMI. This is a wonderful website and helpline. I really encourage people to utilize this if they have questions about mental health and substance use diagnoses, particularly in the age of being able to find pretty much everything on the internet. We can come across a lot of things that may not be the most helpful resources. It's hard to separate fact from opinion, and people's opinions have value, but people's opinions may not be relevant to your life and your lived experience. NAMI can really provide a lot of helpful information that is evidence-based resources. And really, I think the way they explain things can be very helpful. In my experience as a clinician, I often direct people to NAMI to learn more, read more about certain psychiatric or substance use diagnoses, and also to find other people who they can connect with to ask questions about living with mental illness or living with someone and loving someone and caring for someone who may be suffering. for mental illness and substance use disorders. One of the really impressive public health expansions that's happened in the last few years is that we now have a dedicated 988 suicide and crisis lifeline that is 24/7 free and confidential support for people in distress. This is essentially 911 specific to mental health. And this is something that you can access, not related to your healthcare benefits. This is just part of being a citizen. Additionally, of course, in an emergency, if you or a loved one are experiencing an emergency, we would always, refer you to 911 or to go to the nearest emergency room. So, what does treatment and recovery look like for somebody who's suffering from both mental health and substance use challenges? It can be difficult because it's important to address both areas. As I hope I've conveyed up till this point, one and the other are often intimately intertwined. Recovery options can include outpatient counseling, inpatient rehabilitation for substance use disorders, behavioral health care that focuses more on a primary mental health illness but acknowledges the role of substance use. And of course, there's medications in combination with counseling and behavioral health therapies that are often an option. Um, you should talk to your healthcare provider to determine the best treatment for you or your loved one. And it's important to give any treatment plan a chance to work before deciding if it's right. That can be so challenging. When we're in the throes of addiction, it's really hard to be patient. But oftentimes we do need a little bit of time to let the treatment plan start to work. I do want to take a few minutes to talk about some of the medications that we use for treatment of things like opioid use disorder, and also some important and life-saving interventions that are really useful for you to know about for yourself, for loved ones, for being the member of a community where there are people walking around with things like opioid use disorder. Opioid use disorder, as I mentioned before, is a dependence on substances, things like heroin, fentanyl is a common one that you may have heard of, prescription opioid pills like Vicodin, uh, hydrocodone. This is a disorder that may require medication as the first course of treatment. Medications for opioid use disorder can help with both cravings for the substance, which can be quite profound, and to manage the withdrawal symptoms, which can be so overwhelming, they may actually lead people to relapse, even if through their best intentions they want to quit. You can't die from an opioid overdose, but if you are in you can die from an opioid overdose. Let me be clear on that. You cannot die from opioid withdrawal, but going through opioid withdrawal feels like dying. Medications for opioid use disorder are helpful in reducing illegal opioid use, helping people stay in treatment longer, and reducing these potentially deadly overdoses. These include drugs like methadone, which eliminates withdrawal symptoms and reduces drug cravings, buprenorphine naloxone, which is also known as Suboxone. This works in a slightly different mechanism than methadone, maybe a little bit easier to access and self-administer, but it can also reduce cravings and withdrawal symptoms. And then another medication called naltrexone, which does not reduce any of the withdrawal symptoms, but it can reduce cravings and prevents opioid drugs from really producing rewarding effects like euphoria. So it can help people to maintain their recovery. These are all important options in the tool belt of treatment for opioid use disorder, although they are not the only option for treatment. Another parallel topic that I really want to spend a few minutes talking about is naloxone. This is a life-saving medication that can reverse an overdose from opioids. It is a drug that can be administered intranasally. It's actually like a little puffer that goes up your nose. And what it does is it reverses the effects of opioids on the brain quite quickly and quite profoundly, but for only a short window of time. If you were to come across someone that you had suspected had had an opioid overdose, the first thing you should do is call 911 because they will need emergency care because the naloxone, whether or not you use it, will wear off quite quickly. After you call 911 and tell them you suspect someone has an opioid overdose, you administer the naloxone. If you're trained and comfortable doing so, you can also administer rescue breathing and chest compressions until the person wakes up. I'll tell you, when someone comes up from an opioid overdose, they're going to come up kicking. So you probably want to be a little bit away. What happens is the high is almost immediately overcome. They will be very uncomfortable, in profound withdrawal, and they'll be mad, but they'll be breathing. If someone does not respond to the first dose of naloxone, 1 to 2 minutes later, you can administer another dose. Once 911 emergency response services show up, they will take over. And once someone gets to the hospital, if the opioid overdose is not able to be reversed without repeated doses of intranasal naloxone, they actually put you on an IV drip until time helps the drugs to metabolize. They're also being observed for the signs of overdose. Signs that someone may have experienced an opioid overdose. Falling asleep or loss of consciousness in a context that doesn't really make sense. This is that nodding off. Shallow or very, very low breathing. A limp body, although with fentanyl overdoses, the body may be rigid. Choking or gurgling sounds. Small, constricted, or what we call pinpoint pupils. You may or may not be able to see their eyes, and it may not be safe to get close enough to see them. And then, of course, pale blue or cold skin, lips, or nails. These are all signs of an opioid overdose. And we have Good Samaritan laws in New York State that allow you to administer naloxone to someone if, in good faith, you believe they have had an opioid overdose. Essentially saying, like, if something were to happen, you're not going to be charged with assault because you administered naloxone to somebody who did not, in fact, have an opioid overdose. The good thing about naloxone is that it does nothing to the body if there are no opioids on board, so it would not cause someone harm. So you may suspect or discover that a loved one is dealing with mental illness, drinking too much, or using drugs. Each of you individually can really play a critical role in getting a loved one the help that they need. One of the really important things is to reduce stigma, because stigma makes it harder for people to get help. Substance use disorders look different for everyone, and for many, the struggle is really hidden. For others, it's more obvious. It can result in the loss of relationships, employment, housing. It can lead to criminal convictions. And each person is going to face unique barriers to recovery. And what's so important is to acknowledge that each person really deserves the compassion, support, and access to recovery and treatment services. A lot of times people are too scared to ask for help because they don't know what someone is going to say. So we can reduce stigma by increasing education and awareness through talks like this and through all of you coming and hopefully taking something home with you. By promoting health equity, which is really promoting access to care and treatment resources for everyone. And then using a people first approach. I find this really helpful as a clinician as well. Substance use disorders shouldn't be thought of a trait as as to define someone. You are not Joe the alcoholic. You are Joe, a person who is a partner and a parent and a worker, and you may have a substance use disorder. And I think that's really important in reframing that around a person to really give them uh, more space to have their whole humanity. What can we do to support the loved ones dealing with mental health and substance use disorders? We can talk to them, express our concern, and just tell them you're here to help. We can be open, discussing our own history of mental illness or drug and alcohol use if it's relevant. We can show compassion and be patient. We really need to take care of ourselves too. Being a caregiver can be highly stressful and emotionally draining. We need to fill our own cups first. We can help our loved ones seek support, working with them to find the help that they need, and really remembering and leaning on the knowledge that mental health and substance use disorders are treatable illnesses. People can and do recover. I've seen it many, many times in my career. Your support to someone struggling now can make all the difference in helping them to be somebody who makes it on the path of recovery.
Dr. Elliott, thank you so much. That was such a wonderful overview and a lot of great information. Just for the sake of time here, I'm going to move right into some related benefits. Many of these you already covered, so I'll touch quickly on them. But as mentioned, one of the first things that Dr. Elliott mentioned is the Find a Doctor tool available on our Univera Healthcare website. So that allows you to search for in-network providers, maybe in the behavioral health specialty, whether it be therapy, psychiatry, social worker. So once again, being able to filter those results to find a provider that is going to be the most meaningful for you or a family member is a great tool to utilize, as well as the MD Live services that Dr. Elliott mentioned. So, if interested in exploring behavioral health therapy or psychiatry with MD Live, we can see some of the conditions associated here with MD Live, such as addiction, anxiety, depression, stress, and more. The cost for a telemedicine visit, I do want to call out, does vary based on your specific plan, but the first step, which is free, is to get registered your MD Live account. So we can see the 4 different methods here on this slide if interested. Simplest one I find is texting the word Univera to 635-483, which sets up a chatbot to get your account registered. And then also, as Dr. Elliott mentioned, we have a behavioral health care management team here at the health plan that is very well versed to help support our members who may be looking for additional resources or connections to resources within the health plan or community. So one way to connect with our care management team is through the free WellFrame app that any Univera member can download. And the access code when registering your WellFrame account is Univera Welcome, all one word, all lowercase. So once again, that direct access to our behavioral health care team to support you and what you may be looking for. And then last but not least, the Vitalize program. Some of our members do have access to the Vitalize program through Personify Health. I do want to call out this benefit does specifically vary based on your contract, but the Vitalize platform provides you a digital platform to support all aspects of your well-being, whether it be from nutrition, physical, mental health, all those good things to help support well-being through Personify Health. And then once again, this benefit does vary based on plan, but some members do have access to a paid subscription to Headspace, which is a mindfulness app that can really help to once again support resilience, mindfulness, and more, and better manage stress levels. So encouraged to log into a Univera online account to see if those benefits apply to you. But with that being said, once again, just thank you, Dr. Elliott, for your time. I do want to ask everyone, if interested, who attended here today. My colleague Kate just put in the chat a little survey. Will take 2 minutes for you to complete if interested, to just give your feedback on today's webinar, as we're really looking to just learn what our members want to hear more about to support your well-being. So that survey and the feedback will help guide us as we continue to move forward with these well-being webinars. So as mentioned, if you do have any questions, please feel free to enter them into that Q&A right now. We'll get to them in just a second. And then last but not least here, before we do so, it's just a quick plug for our upcoming October webinar on Menopause Unmasked, supporting women through the transition. That is going to be with Dr. Kathleen Robichon, another one of our medical directors here at the health plan, on Wednesday, October 22nd at 12 o'clock. Once again, thank you, Kate. She just put the direct registration link if interested in signing up for that one, or you can scan the QR code here on this slide. So with that being said, Q&A, let's go into that to see if we have any questions that have come through. I don't see any, so once again, just as of yet, so last plug, go into that Q&A icon, enter any questions you may have relative to the content covered here today, and we'd be happy to address them. And if not, once again, Dr. Elliott, I think that means job well done. And once again, we just appreciate everything that you brought forward here today.
Thank you all.
All right, so it doesn't look like any questions, but once again, please note this is recorded, will be placed on that Univera YouTube page typically within the next week or so. So feel free to give it a listen back if you need to. And once again, just thank you all for your time today. We hope to see you next month.